particular, my portfolio is working on the area of pandemic preparedness and One Health approach in the region. First of all, I must say that the journey was long. It's been 1.5 years. I'm happy with the outcome of the field simulation exercise. Our intention of undertaking simulation exercises at the regional level was to test the regional documents and the national documents that we have, and at the same time testing the standard operating procedures. The main document that was under test was actually the improved regional contingency plan that embraces the One Health approach. It gives a clear structure for responding to diseases. I think as a region, we can now be able to respond to a disease outbreak of maybe big magnitude. One of the challenges was in preparation of this field simulation. It was not so much on the technical side. It was so much on the logistical side. This field simulation, I must say, is the third field cross-border simulation in the East African community, but it was of such a big magnitude. Personally, I would still involve all the sites. It reflects the real situation. That's what a simulation is. Trying to push ourselves to the limit to reflect what a real situation is. So while it was a bit challenging, I think it was realistic, and it was good that we tested them, the whole line, in terms of the governance levels in the two countries. At the same time, this also involved the regional level, activation of the regional level. My major lesson learned in this exercise, coordination is critical in responding to disease outbreaks. Coordination between the governance, across the governance levels and across the districts. The second technical thing I would like to take as a take-home message is the aspect of infection prevention and control. It's a critical issue that all our people, even at the lower level, should be very conversant with. Because if we can be able to have these practices on infection prevention and control at lower level, we can really limit disease spread. We should have more frequent simulation exercises. They may not be of this magnitude, but we can do tabletop simulations or drills to be able to help us to keep well prepared. The countries and the regional level should actually invest and develop and strengthen their emergency operation centers. Linked to the emergency operation centers is, of course, the rapid response teams. These people should be well equipped so that they can be able to respond in time. The other thing that I would like to make as a recommendation, and I think is critical, is that it would be good to make budgetary provisions for simulation exercises, because simulation exercises will help us in enhancing preparedness in the region. They actually really push the system to be able to improve its preparedness. And lastly, it would be critical that we mobilize resources to make sure that this is going on. The very last one is that whatever that we have learned and we have gotten in terms of our strengths or weaknesses, we should be able to develop proper action plans for us to make sure that we implement and address all the issues identified in the region to improve, of course, our preparedness and response. I know it has been a very tiring exercise, but there's one thing I would like to say. At school, we are mainly trained on the technical part. But I've come to realize if you are responding to a big disease outbreak like this one, the logistical parts of it are critical. In really operation, like if there's a big outbreak, the logistics then become a critical element. Not much is covered maybe during school time, but it's a critical element I have realized in the whole operation. The right equipment, drugs or vaccines or whatever being in the right place at the right time can save the whole country, can save the whole region. You can know what to administer, but if it's not available, the issue of time is critical. So I would recommend that. I know we have logistical experts, but it's also good that experts in other areas like human medicine vet or other specialists, environmentalists, and all that, I think they should also have some basic knowledge on issues of logistics. It can ruin it. From my perspective, though it has been very tiring, it is worth the effort. We have learned a lot in this exercise. I have interacted with people from this region and out of this region who participated in this exercise that have totally appreciated what we have done. They have told me personally that they would like us to also help them to do such a like thing and test their contingency plans, especially people from the South African countries that participated.